down at your feet right now. Do they tingle? Do they feel numb? Are they cold even when the room is warm? Most people think those feelings are nothing, just tired feet, just getting older, and nothing serious. Those signs in your feet could be your body's way of telling you something is very, very wrong inside. And here is what nobody tells you. Diabetes is one of the most dangerous conditions in the world. Often starts silently, no chest pain, no fever, no obvious warning signs. And it starts in your feet. And right now, millions of people are walking around with diabetic damage happening inside their body, and they have absolutely no idea. So in today's video, I am going to show you 9 warning signs in your feet that could mean diabetes is already affecting your body, and I will give you simple practical steps you can start today to protect yourself. This could be the most important 10 minutes of your life, so let's begin. Every time you eat, whether it is rice, bread, fruit, or a biscuit, your body breaks that food down into sugar. That sugar goes into your blood. Now, your body has a key, and that key is called insulin. And insulin's job is to open the door to your cells so that the sugar can go inside and give you energy. But when you have diabetes, one of these things happen. It's either your body doesn't make enough insulin, so the key goes missing, or your body makes enough insulin, but your cells stop responding to it. That means the lock is broken. So the sugar has nowhere to go. It just floats around in your blood, building up, getting higher and higher. And that extra sugar, it is toxic to your blood vessels and your nerves. So over time, sometimes over years, that high blood sugar quietly destroys the tiny blood vessels and nerves throughout your entire body. And here is the dangerous part. Your feet are the furthest from your heart. The blood supply there is the weakest. The nerves there are the tiniest. So your feet are always the first place the damage shows up. That is why your feet are the window into what diabetes is doing inside you. And that's why these 9 warning signs are so critical to know. Then the first sign, tingling or numbness in your feet. You know that pins and needles feeling when your foot falls asleep? Imagine that, and it doesn't go away. When your blood sugar stays high for too long, it damages the nerves in your feet. What that means for you is simple. Your nerves are being slowly injured by excess sugar in your blood. That tingling or numb feeling is your nerve sending you a distress signal. Don't ignore it. Then the second sign is burning or pain in the feet. Some people feel the opposite of numbness. They feel intense burning, like their feet is on fire, especially at night when they try to sleep. This burning pain is the damaged nerve misfiring. They are sending pain signals even when there is no injury. It's one of the most uncomfortable early signs of diabetes and one of the most dismissed. The third sign is cold feet that never warms up. If your feet feel cold even when the rest of your body is warm, even when you are wearing thick socks, pay close attention, because high blood sugar damages the tiny blood vessels that carry warm blood to your feet. When those vessels narrows and weaken, less blood reaches your feet. Cold feet means poor circulation, and poor circulation in your lower limbs is one of the earliest and most overlooked signs of diabetes. Then the fourth sign is swelling in the feet and ankles. A little swelling after a long day on your feet can be normal, but if your feet and ankles are swollen regularly, especially in the morning or after a rest, something deeper may be going on. Diabetes damages the blood vessels well. When those blood vessels are weak, fluid leak into the surrounding tissues, that is swelling. And when diabetes begins to affect the kidney, which it often does over time, the swelling becomes even more significant. And the fifth sign is slow healing cuts or wounds. This one is very serious. If you have a small cut, blister, or scrape on your foot and it is taking weeks to heal, that is a major warning sign. High blood sugar slows down your body's entire healing system. Your white blood cells, which is your body's repair crew, cannot function properly, and poor circulation means less blood and less oxygen and less healing power reaching the wound. In advanced diabetes, small wounds on the feet can become dangerous infection. That's why diabetic foot complications are one of the most leading causes of amputation worldwide. Then the sixth sign is dry, cracked, or peeling skin on the feet. The nerves in your feet also control your sweat glands. When those nerves are damaged by diabetes, your feet stop producing moisture naturally. And here is the result. They will be dry, rough, cracked skin, especially around the heels. And cracked skin is not just uncomfortable, it creates an open door for bacteria and infection to enter, which in someone with poor circulation and slow healing is genuinely dangerous. Then the seventh sign, changes in the color of your feet. This is the one that surprises most people. Look at your feet right now. Are they unusually pale, bluish? Do they turn red when you hug them down? This color changes happens because blood is not flowing properly. Pale feet means not enough blood arriving. Blue or purple feet means oxygen depleted blood is pooling. Redness when the feet hangs down can indicate serious arterial damage. So any persistent color change in your feet that is not from cold temperature should never be ignored. Then the eighth sign is hair loss on the toes and lower legs. Have you noticed that the hair on your toes or lower leg have become thin or disappear completely? This quiet change is something most people overlook entirely. See, hair follicles need a consistent blood supply to survive. When diabetes reduces circulation, hair follicles in the lower leg and the foot area begins to die off. The hair stops growing. It is a subtle, easy to miss sign that blood flow is failing in your lower body. Then the next sign is the thick, yellow or crumbly toenails. You see, thick, discolored or crumbling toenails are sometimes just a fungal infection. But in people with high blood sugar, fungal infection happen far more easily because glucose-rich blood creates a perfect environment for fungus to thrive. So toenails look unusual and you have other signs from the list. Do not wait, get checked as soon as possible. Now here is what most people never realize, and this is the part that really change your life. Most people believe diabetes starts suddenly. That one day you feel terribly sick, go to the hospital and get the diagnosis. But the truth is, damage starts years before the diagnosis. There is a condition called prediabetes, where your blood sugar is already higher than normal, but not yet enough to be officially called diabetes. And right now, estimated 1 in 3 adults has prediabetes. And here is the dangerous part. 8 out of 10 people with prediabetes do not know they have it. They feel fine, they go about their lives, but inside, quietly, the nerves in their feet are already beginning to suffer. The blood vessels are already beginning to narrow, the damage has already started. By the time most people are officially diagnosed with diabetes, the nerves in their feet have sometimes been damaged for 5 to 7 years already. That means your feet are not just showing the signs of diabetes, they are warning you before diabetes steals your quality of life. This is your body giving you a second chance, a window to act, a moment where the right knowledge can completely change your outcome. And that's why what you do in the next few days matters more than you know. And before we get into the solution, I want to ask you for something. If this video is helping you to understand your body better, please hit the like button right now and subscribe to this channel, because this one tap tells the platform to show this video to more people, to someone's father who has been ignoring numbness in the feet for 2 years, to a mother who thinks her cold feet are just poor circulation from the weather, to a young person who does not yet know their blood sugar is already climbing. Your like could genuinely help save someone's life today. So type it right now and don't forget to subscribe to this channel. So here are some practical solutions starting today. Step 1. Check your feet every single day. This takes just 20 seconds every morning or evening. Look at the bottom of your feet. Check between your toes. Use a hand mirror if needed. Look for any cuts, any sore, blisters, or color change, any swelling, or anything unusual. The earlier you catch a problem, the simpler it is to solve. If you already have diabetes, ask your doctor to check your feet at every single visit. This is your right as a patient. Then the second step, change what goes on your plate. Starting today, you do not need a complicated diet, you just need one simple understanding. Every meal is either helping your blood sugar or hurting it. So you need to reduce or avoid some things. Things like white bread, white rice, sugary drinks, packaged snacks, sweets, fried food, processed food juices. These things spikes your blood sugar rapidly. And as you avoid this, make sure you increase intake of leafy greens like spinach, kale, whole grains like oats, brown rice, beans, lentils, fatty fish like salmon, sardines, eggs, nuts, avocado, fresh vegetables of all colors. Then the third step is that you need to move your body every day. You do not need to run a marathon. Walking just in 20 to 30 minutes a day is one of the most powerful tools you can have to lower your blood sugar naturally. When you walk, your muscle absorb sugar directly from your bloodstream without needing insulin. That means even a short daily walk is actively reducing damage to your feet and nerves right now. If walking is difficult due to foot pain or limited mobility, try gentle seated leg exercise, swimming, or a short chair yoga routine. Any movement counts. Movement is the medicine. Then the fourth step is hydration. Make sure you hydrate and protect your feet. Drink enough water every day. Aim for 6 to 8 glasses of water because dehydration thickens your blood and makes circulation significantly worse. Also moisturize your feet every night, but not between the toes, as trap moisture can encourage fungal growth. So use gentle lotion, shea butter or coconut oil on the sole and heels. And always wear proper fitting shoes with good support. Tight or poor fitting shoes cause blisters and pressure sores that in someone with poor circulation can become serious very quickly. Never walk barefoot outdoors if you have any of the signs from this video. Then the fifth step is for you to get tested. Do not wait. If you have 2 or more of these signs from this video, please see your doctor soon. Ask for a fasting blood sugar test or a glycated hemoglobin test. These are simple, inexpensive tests. They give a clear picture of where your blood sugar is right now and whether action needs to be taken. Because early detection changes everything. The earlier you know, the more power you have. So if you found this video helpful, please share it with someone you care about. And don't forget to subscribe to this channel. Thanks for watching this video. Take care of yourself and I will see you in the next one. Bye for now.